highlights?
Yeah, so I would say, so the main highlights are that I'll just describe the committee very briefly. So the committee was pulled together by the Alzheimer's Association. The membership was selected to reflect broad areas of expertise, neurology, neuropathology, imaging, fluid biomarkers, et cetera, but also to provide a blend of industry and academia, and also a blend of regional locations, so US and Europe. So it was designed to be broadly representative of, people working, I would say, sort of at the state-of-the-art level in this field. So that was the committee, and the purpose of the committee. So, and this is actually important. I think this is probably not necessarily generally well understood, but the purpose of the document that this committee produced was to provide overall or general principles around diagnosis and staging of Alzheimer's disease that reflect current science. And current science is it's an important piece of this. So the purpose was not to offer specific clinical practice guidelines. It was not to offer a step-by-step sort of workflow for clinical practice tomorrow or next month, but rather to, again, inform how people in the field should think about the diagnosis of the disease and staging of the disease from a broad scientific perspective. And why do I make the distinction between everyday clinical practice and, let's say, cutting edge science? Well, I mean, we talk about in the document, we talk about some biomarkers that look extremely promising, very useful, but that are not available for everyday clinical practice at this time. We think they will be in the near future, in the coming year to years, but they're not at this time. And so at the same time, if you're going to have a document that really does synthesize what we think the current science says about how the disease should be diagnosed and how it should be staged, you have to include aspects of science that are not available for everyday clinical practice. So that's why we view this as a bridge between clinical practice and research. It's not purely a research-only document. It's irrelevant for clinical practice, but it's by no means a detailed clinical practice guideline. Actually, there is a detailed clinical practice guideline that will be coming out from the Alzheimer's Association, but probably not till next year sometime. So that was our objective in broad strokes, yeah. And so, and we divided, I would say, our task into different sections. We approached the issues at hand, I think, in a very logical way. So we first thought through, and I guess I should also say, why did we come up with these revised guidelines? And the people in the field probably are well aware that the last set of these guidelines was published in 2018. And since 2018, there have really been three big, I would say, changes in the field that have occurred. One is the development of plasma biomarkers, some, not all by any means, but some with very good diagnostic performance that's essentially equivalent to approved CSF assays. They didn't exist in 2018 when the last set of criteria were put together. Two, approved treatments that target the disease pathology, the disease modifying treatments did not exist back in 2018. And the third, which is maybe a little bit more inside baseball, but recognition that imaging and fluid biomarkers within a disease category, like the A or the T category, are not interchangeable for all uses. That assumption was made in the prior research framework criteria, and we break from that assumption in the current. revised criteria. So certainly points number 1 and 2 are major developments that have had a substantial impact on changing the landscape since 2018, hence the need, feeling that new criteria needed to be put together. And we approached the development of these new criteria, I think, in a very logical, sensible way. So the first thing we did was rethink how biomarkers should be classified. Incorporating then plasma biomarkers that are now available, which weren't in 2018. The second thing we did was we thought through how should the diagnosis of the disease be made in this new era of plasma biomarkers. The third thing we did was put together a staging scheme for the biology of the disease. We really kept intact, unchanged, the staging scheme for clinical severity back from 2018. And then we created an integrated staging scheme that integrates clinical severity staging along with biological staging.